Hi, my name is John Edwards. I'm the Family Medicine Residency Director here at Samaritan. I've been here for the last 3 years, and prior to that, I was serving on active duty in the Army. Our program has 3 continuity clinic sites, one here in Corvallis, we have one in Lebanon, Oregon, which is about 18 miles away, and we have one in Albany, Oregon, which is about 11 miles away. In the 25 years that I spent in the Army, I spent most of my time in resident education. After residency, I spent about 2 years in a community hospital. We were doing inpatient, we were doing outpatient, ICU, delivering babies. Really decided that I wanted to get back into medical education and got accepted into a faculty development fellowship. As part of that, I worked as a core faculty member at a residency program. After about 2 years of doing that and after a long deployment, came back into the residency program as an associate program director. I became the residency director for the family medicine program. After about 5.5 years of being the program director, I was promoted and unfortunately was no longer able to stay in that role due to my rank. And so I moved up into the executive suite as one of the hospital vice presidents. After 2 years of not seeing patients, not teaching residents, I realized that it was time for me to retire from the military and find a job that would allow me the opportunity to get back into patient care, get back into teaching. But I also knew that I wanted to look for an organization that would support me and provide me autonomy in being able to create the best residency program that we could. Samaritan was absolutely committed to their mission of serving the communities for the 5 communities that we have hospitals, and realized that this was that wonderful breeding ground to be able to train family medicine residents, and already had a core of faculty that were already doing that. So I moved down here with my family. I've been married for about 20 years, and I have 2 kids. I have a 15-year-old and a 17-year-old. My kids are both competitive swimmers, and so I spend a lot of time in a swimming pool. And when I'm not at a swimming pool or chasing children around, I have gotten into both camping and into boating. And so right now I'm in the process of renovating a 1986 boat that we're hoping to take to Alaska someday. We're hoping to have full osteopathic recognition by the summer of 2021. We're also expanding our obstetrical care. Last year we started doing group-based prenatal care with our midwifery group. In the summer of 2022, we're hoping to have a rural training track opening in Newport, which is on the coast. We got about $1.2 million in grant money in order to be able to start that clinic. We focus on mindset as one of the very first things that we do in residency training, so that we understand what the needs, hopes, desires of our residents are, so that we can address those and create a safe environment so that we can train the best family physicians that we can. We also believe in a longitudinal curriculum that allows for progression. It's very important that we create a curriculum that prepares you for the next step. The United States has over 500 family medicine programs. All of them are accredited. All of them are going to provide a good education for you as an applicant. There are some programs that are going to specialize in certain areas that may resonate with you. So there's some programs that are very obstetrically heavy, some are rural programs, others do serve an inner-city population. Most of that stuff can be figured out from a cognitive standpoint, looking at websites and looking at other resources. As you interact with each one of the residency programs that you're going to interact with, my recommendation is to go ahead and write down all of the cognitive stuff that is important about that program, but also to take stock in the affective portion of the program. Because you're going to be spending 3 years or more with a program or at a site, and it's important that you feel like you're part of that team. I encourage you to reach out to us for more information or to contact us, and we look forward to interviewing with you.